Welcome to our comprehensive look at Mpox, a rising global health concern. Over the next few minutes, we'll delve into the history, current status, and future outlook of Mpox, as well as what you can do to stay informed and protected. Let's begin our journey into understanding this significant public health issue. The story of Mpox begins in the 1970s. Discovered in Central Africa, Mpox was first identified in monkeys used for research, hence the initial name Monkeypox. However, it's not just monkeys that are affected. The virus is known to infect a range of mammals, including rodents and even humans. For decades, Mpox was primarily confined to Central and West Africa. In these regions, it was mostly a localized issue, with sporadic cases reported. The disease typically emerged in rural areas where contact with infected animals was more common. However, the landscape began to change in recent years. In 2017, a significant outbreak occurred in Nigeria, which was notable for its larger scale and the fact that it affected urban areas. This was followed by a surprising global spread in 2022, when Mpox cases were reported in countries outside Africa for the first time in decades. Mpox is caused by the Mpox virus, which belongs to the orthopox virus genus. It shares similarities with the smallpox virus, but is generally less severe. The virus is transmitted through contact with infected animals, typically rodents, or through direct human-to-human contact. The symptoms of Mpox can be quite distressing. They typically begin with flu-like symptoms, fever, chills, and muscle aches. A distinctive rash then develops, starting on the face and spreading to other parts of the body. The rash progresses through several stages, from flat lesions to raised bumps, and eventually to pus-filled blisters that scab over before healing. While the disease is usually mild and self-limiting, it can be more severe in certain populations, including children, pregnant women, and individuals with weakened immune systems. Complications, though rare, can include secondary bacterial infections and, in some cases, death. Managing Mpox requires prompt and effective public health responses. Health workers need to wear protective gear to prevent transmission, especially when handling cases or working in outbreak areas. Isolating infected individuals and tracking their contacts is crucial in controlling the spread. One of the most effective tools we have against Mpox is vaccination. The smallpox vaccine, which is related to the Mpox vaccine, has been shown to provide some level of protection. In response to the recent outbreaks, health authorities have ramped up vaccination efforts, especially in high-risk areas and among high-risk groups. Education is equally important. Awareness campaigns help people understand the symptoms of Mpox, the importance of vaccination and preventive measures. Communities are being educated on avoiding contact with potentially infected animals and practicing good hygiene. Research is at the forefront of our battle against Mpox. Scientists are working tirelessly to develop more effective vaccines and treatments. Advances in biotechnology and genomics are helping us understand the virus better and develop targeted therapies. Researchers are also exploring the possibility of using existing antiviral drugs to treat Mpox. Global collaboration is essential in tackling Mpox. International health organizations like the World Health Organization, along with national public health authorities, are coordinating efforts to monitor outbreaks, share information, and provide support to affected regions. This collaborative approach is vital for managing and ultimately overcoming the threat of Mpox. In addition to vaccination and treatment, personal protective measures can help prevent the spread of Mpox. Practicing good hand hygiene, avoiding contact with sick individuals, and following public health guidelines can all reduce the risk of infection. Community support plays a key role in managing health crises. By working together and supporting public health measures, communities can help reduce the impact of Mpox. Everyone has a role to play, from individuals following health guidelines to communities providing support and understanding to those affected. Looking ahead, there is reason for optimism. With ongoing research, improved vaccines and strengthened public health systems, we are better equipped than ever to handle Mpox outbreaks. By staying informed, adhering to health guidelines and supporting global health initiatives, we can collectively address this rising concern. Mpox may present challenges, but with vigilance, collaboration and continued dedication, we can manage and mitigate its impact. Thank you for joining us on this in-depth exploration of Mpox. For more information, stay tuned to reliable health sources and continue to support public health efforts. This has been your special report on Mpox. Stay safe, stay informed, and together, we can make a difference.